So, Don, you had a question. Feel free. By the way, Don Ewing has been one of our longest and most active people in the state of New Hampshire for AFP for years. I want to give him a ton of credit. He won't take it because that's just the way he is. But Don Ewing.
Thank you. There are three things that I wanted to mention. Number one, the other side is not going to roll over and play dead. They want this. They want the control of all of this. So you're going to hear things. You're going to hear that Obamacare is going to reduce the cost of healthcare premiums. And they're going to give you some examples. There are about 4 to 6 states that have so screwed up the health insurance industry in their own states that, in fact, the exchanges are going to offer cheaper insurance than what is available today in those states. But for the rest of us, okay, the rates, in other words, 44 states out of the 50, the rates are going to go up under Obamacare. Okay, so just so you know, when you hear, New York rates are going to be cut by so much, yeah, New York has really screwed it up already. We haven't screwed it up that badly yet. That's number one. Number two, you're going to hear again, you may know all this, but you may hear again how the American healthcare system is the most expensive and it's terrible. We're 37th in the world in terms of being able to provide quality health care. Well, the thing is you have to look at the criteria that they use. Okay? Now, if what your criteria says the important thing is that you provide essentially socialized health care, everybody gets the same health care. No co-pays, no premiums, no nothing, then that, if that's their priority rather than that you get quality health care, then, we get quality health care. Everybody gets, over in Colombia or something, they all get the same crappy health care, but it comes from the government for free. So theirs is rated better than ours. Okay, can you believe Cuba is rated better than ours, if I remember correctly, on the World Health Scale. Okay, but Castro, why didn't he have a wonderful Cuban surgeon take care of him? We got some back from Spain. He would have loved to go to the Mayo Clinic, I can assure you. Okay, so you're going to hear their arguments, and a lot of their arguments are really phony. Okay, so especially on this, one of the other things about the World Health Organization has to do with infant mortality. Okay, here is another area where the criteria really matters, and the criteria in different countries is different. If we have a baby, I don't remember exactly the criteria, but essentially if it moves or takes a breath, that's a live birth. In some of the other countries, it has to live for an hour, or maybe until it gets its medical degree or something, I don't know, but it has to live for some sustained period of time before they consider that a live birth. So the criteria is always what counts in many of these things. You got to look carefully. So that's on Obamacare. I'd like to make one other comment if I can. The next thing I think that's coming up in New Hampshire is the Medicaid expansion stuff. The Senate's supposed to be looking at that. I think the House already passed it. This is really important, I think, that we contact all our state senators, make them know that we don't want that. The feds are telling us, and the supporters are telling us that this is great because, it's free. We're not going to come and take that money out of our right-hand pocket in order to fund Medicare for the first 6 years or whatever it is, or the Medicaid Advantage. And of course, what they're doing is they're coming to take the money out of our left pocket. They're taking it through the federal government. They're taking the federal government's cut, and then they're giving it back to us, and they're making us set up a program that we could have set up at any time. Any time the people of New Hampshire wanted to provide all those benefits, quote unquote, we could have done that. You didn't need them for that. Exactly. Okay? So this is just a way to induce us to do something that the people of New Hampshire have really not wanted to do so far. So anyway, get to your New Hampshire senators and tell them. Thank you.
Thanks so much. Okay, one more question, and then we'll let people go. Go ahead.
Yeah, I don't know that it's really a question, but I would encourage everybody, as soon as they already have, to go to don'tfundit.com and and sign it. They have almost 400,000 signatures now, there's 42 more days to go. So if you haven't done that, please do.
Okay, well, thank you so much.
Greg, question right here.
One more question.
Okay, well, last question.
Okay, the other thing is fight like crazy to stop this amnesty too, because if they flood the country with all of these people, we will never get rid of Obamacare because they will all vote for it. So call the RNC, call all your representatives, your senators, put pressure on them to stop this amnesty too.
We have
Well-
representatives that don't listen.
Well,
But they do record if you call and say no. They keep track of that.
okay, well, I'd like to thank everyone for coming. I really appreciate you coming out, as I said, on a beautiful summer day when I could have figured out 10 things I'd rather do, like be sitting on a deck somewhere drinking a frozen beverage. But anyway, I really appreciate every one of you coming out today and joining us and coming in and participating. And I would just say, please stay involved. It's going to be this is not going to be a sprint. It's going to be a marathon, and we need you to stay involved and engaged throughout the course of it. So thank you everyone for coming, and we really appreciate it. And hey, have a great day. Thanks.
Croc TV.